you, thank me for being
That's one thing to
here.
claim.
Save the day.
Okay.
I call him
I'd like to call the
and his wife.
Health Committee meeting to order. Can I get a motion to approve the previous meeting minutes? Motion moved. By Gary, second by Bill, all in favor? Any opposed? Number one, resolution number 336, a resolution to initiate a pilot polystyrene recycling program.
I understand that this is being tabled at the present time for further discussion.
That's correct.
Bill, by the sponsor.
That's correct. He's not here, but yeah, that's correct.
Okay, current business, number two, authorizing an agreement with the Homeless and Travelers Aid Society regarding case management services for the re-entry program. Dr. Giordano?
Good evening, Mr. Chairman. This is a request to enter into a one-year contract with the agency named. You all may remember that I've brought to this body a number of times the contract we have with DCJS to provide a reentry task force. This is a component of that. Last year we processed, for lack of a better term, 250 returning citizens to Albany County out of prison. These case management services are used to connect these folks to mental health services, to job opportunities, to housing, and it is no county share. It's a direct funding from DCJS, and we've been pretty successful in the last couple of go-rounds. This is actually a continuation with this agency. Their 3-year previous contract for this specialty service expired, so we're asked to re-enter.
Any questions? Mark?
Thank you, Mr. Chairman. There are 250 of these folks.
The target that DCJS gives us last year was 250. Each year incrementally a little more, but yes, 250, give or take.
So my question is, what do we hope to do with those 250? And are we tracking how well we did based on our intention?
Yeah. So we're probably in our 6th or 7th year of the task force.
Okay.
And as many of you have asked previously, it's a cooperative group of many stakeholders in the community, from treatment, faith community, law enforcement. We gather every month and review these cases. The people that come through here are in various stages of risk for recidivism. So there are more than 250 people coming out of prison, but they're rated before their release at a risk level. So we get the referrals for people who we believe are at risk because they don't have housing, they don't have jobs, they have untreated addiction, etc. We're not successful with every one of them, although we touch every life that is sent to us. But we keep pretty good tracking data for DCJS and ourselves, and a lot of the folks end up in our mental health system. And the recidivism rate is reported out to the state. It's much lower than it was before we had a reentry task force.
So one of the things we track is, do they go back into prison?
During the time that we have them, and then we don't keep them forever, and then afterwards as well. So there's two sets of data.
So there's data for, while you have them, do they actually go back, which is something, of course, we want to watch carefully.
Yes.
And also, do they get employment or get housing? You have numbers for all that. How are we doing in the 6 years?
So I suppose if I said we're doing good, that wouldn't be... we're doing enough that DCJS has pointed to us as a program that they value, and they continue to fund our request every year. So, I could give you a deeper breakout, but...
I'm just curious, are we doing better each year or poorer in each year? Is what we're doing working, and maybe we can do more of what works?
Yeah. Almost every time I bring this group, this task force up in the community, it's met with, thank God you guys are doing this. And I've heard that at this table as well from some community members. I would ask others if they have feedback about the group. We believe that these folks are much better off than without it, and the recidivism rates show that.
Thank you. Thank you.
I make a motion.
Could we get copies of the actual results, though? Or do you have like annual reports or?
We could probably put it into an annual report for you. It's reported out to DCJS.
Could we get copies of what they get?
I think
I'm sure we could. I mean, it's their data. So
maybe a one-page summary would be better, because
Yeah, sure.
I don't have to go through all that stuff, but
We
a
could
one-page
extract-
summary would be
I
great.
just want, the numbers.
Yeah, How are we
We can
doing?
extract the data.
Paragraph would be fine.
Yes, sir.
How are we doing? Yeah.
Okay, thanks,
Make a
Doctor. We have
motion.
a motion by Gil, second by
Excuse me,
Gary.
Mr. Chairman.
Oh,
Can you note my abstention from the vote, please?
Sure. All in favor?
Aye.
Sure we do that
Any opposed?
on the floor.
Mr. Griggs,
It's just good to know how we do.
Thank you.
Make a motion, we adjourn.
Motion by
Thank you,
Gil,
Doctor.
second by Gary, all in favor? Any opposed? Thank you.
Tell your wife to say congratulations.
Oh, yeah.